Hello, hello, and good morning. Good morning. This is Dr. Yonnette welcoming you to another episode of Baby Talk. Today we are in our new environment. We are on the Skincare Explosion with Dr. Yonnette's page. And this page is going to allow me to post a whole lot more about about childcare and about other strategies, and you can share your pictures and your experiences, your short videos with me, so that together we can raise the next generation of successful children. So this morning I am going to continue talking about the child who has an under responsiveness to sensory stimuli, and I'm sure some of you as parents can identify this in your child. It's not a baby yet, your child is not still a baby, but you can see a 3-year-old, a 4-year-old, a 5-year-old, and even older as they respond to the sensory stimuli that's coming in to their system. And we talked about this stimuli coming through various systems in the body. So today we are looking at a tactile system, and we want to get through as far as possible with other systems. So with the tactile system, what you're going to expect is that the child would have poor fine motor skills. I think I spoke a little bit about that recently, but I want to recap so that we can move forward as we are in this new platform. So poor fine motor skills, that means writing is going to be not so good, or even doing things like buttoning and opening containers and zippering and those things that need the hands, the fingers to work so that they can be done. Okay, the child may be unaware of food on their face. They eat, that's tactile touch. That food is still sitting there on their face and they don't even know it, and they're walking around with food on their faces. They're unaware when they wash their hands. There's soap left on their hands after they've dried the hands. Their clothing is all twisted, and sometimes even put on backwards. So look out for those cues. The child has a low awareness of pain. Do you have a child who gets cut or gets hit really hard, and it's like nothing? They get a cut and they didn't even know they were cut. They're like, it's bleeding, and somebody notices and said, you are bleeding. And then is when the child cues into what's happening. That child is having a low responsiveness to sensory stimuli. And then the child has a poor body awareness. He or she is always bumping into things and, getting into your space. Poor body awareness, so that he or she doesn't actually understand or know where their body is in space. What are some of the strategies that we can use to help this child? Strategy number 1, you want to make sure to provide movement activities before the child sits down to do any table or fine motor activity. Movement activity. Why movement activity? You want to arouse the child, because again, the feedback that the child is getting is not at a level where the child can respond. The sensory stimuli is not at a level where the child can respond appropriately. So you got to wake up that system so he can feel what's happening. You want to do feel and find games without the visual system being activated, right? So you're actually hiding things and having the child just use the touch, the tactile system, to really find what he or she is looking for. And that way you're helping him or her to develop that sense of touch, the tactile system. So you're going to do things like stereognosis and hide objects in like clothing, in objects like beads and cubes, put them in clothing, in the pockets. You want to pace the feeding, cue the child about stuffing, so that he or she slows down. and paces when he or her she is eating, and you want to teach the child to use a mirror. After we're finished eating, grab that mirror. Let's take a look. Let's take a look and make sure we're nice and clean before we move away from lunch. All right? Now, vestibular. Let's look at the vestibular system. If a child has a low responsiveness to sensory stimuli, the vestibular system is going to look like this. The child is going to have a delayed equilibrium action or responses. And equilibrium helps us with balance, right? So that balance is going to be delayed. The child is going to have challenges with flexion and extension patterns. What do we use flexion and extension for? Holding on to things, using the scissors, flexion and extension in the body, in the legs, in the arms. Those patterns are going to be areas where the child is going to have a struggle or some difficulties. So you're going to see that child trips frequently, bumps into objects. I talked about that earlier. The child has trouble maintaining an upright posture. You'll see that child lying down on the table or slouching or, just leaning on somebody that's close to them. And he or she is never really quite upright and centered. And then the child may get hurt frequently on the playground. Because remember, the ability to sense pain or respond to pain is not very much developed in this child. So he or she may get hurt easily on the playground. And so you want to address these issues or these challenges that your child is having by doing the following. Give that child fast movement. All right? He or she's on the merry-go-round. You move him, spin him very quickly, or you put him on the spinning board and you spin him very quickly. Fast, arrhythmic movement. So you're not doing the regular pattern going in a nice rhythm. You're taking it out of rhythm all over the place. Sometimes I feel that amusement parks are really a great place for sensory input for children who are under-responsive. All those thrilling rides and jerks and unexpected movements are really great for children like these. You want to take out the visual system to target the vestibular system. And I spoke about this earlier. Take away the eyes, the use of the vision, and let things be done really internally. The vestibular system that deals with balance and knowing where you are in space. You want to work on the core. Work on the core of the child with flexion and extension. And you give the child activities that involve the extremity, movement of the extremity, moving it away from the midline, moving your arms and your legs away. This is the midline, away from the midline. So you're doing those activities. Think about, sports and activities that would have the child move away from the midline. And then you may also have, in this case, your child may have an abnormal gait pattern. So you may have to seek out the services of a physical therapist so that he or she can help your child have a better response when it comes to the vestibular system. So today we're still talking about how to raise a child who is having an under-responsiveness to sensory stimuli or sensory input. And we said before that the sensory system is how we learn, how we take in information and then use it to help us learn in our environment. And we all come with some measure of dysfunction or need in our sensory system. Is it bad that we need it? No. Are there strategies to help us? Of course they are. And those are the strategies I am sharing with you this morning so that you can give your child the best opportunity to succeed. Remember to take care of you. Take care of your skin. That's what I advocate always. Give yourself the best opportunity to look your best as you raise your child, as you take care of your child. Take care of you and have a fabulous day. This is Dr. Yonnette saying thank you for joining me this morning and wishing you a wonderful day as we continue in our new platform as we talk about raising our children. I am going to go ahead and include some other topics as we start off in this new place, and I look forward to interacting with you on a more personal basis as we do these videos together.